Welcome to the Pure Wellness Podcast, where we talk about what it takes to live a holistic lifestyle by making conscious, healthier choices. Our hope is that these discussions will inspire you to strengthen your daily practice to improve overall physical, mental, emotional, and social well-being. Pure Wellness Podcast provides information solely for educational purposes and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. I'm your host, Johanna Altman, founder of One Body Medicine, avid health enthusiast, and mother of three. Join me and industry professionals as we explore human potential in the pursuit of pure wellness. Hi, everyone. Thank you for joining us today. And with me, I have Dr. Allen.
It's great to be back.
Great to have you. And we're going to be talking about a topic that I've been hearing a lot about, which is the gut microbiome. So my first question, if you don't mind me diving right in, is why is gut health important?
So gut health basically forms the foundation of your overall well-being. Starting with digestion, if you can break down food properly, then you can absorb all the nutrients that your body needs to have energy. And it also plays a crucial role in detox pathways because if you're having healthy bowel movements, you're eliminating all the bad stuff and keeping the good stuff. That's just the beginning of it. You actually have the gut microbiome, which is composed of trillions of different bacteria that live inside of your gut. These bacteria interact with the digestive system and help you contribute to regulating your immune system, modulating inflammation, and affecting even your mood and your energy levels.
Wow, I didn't know that. I've also been hearing that the gut is like the second brain. Tell me more about that and why is that?
That's right. So your gut is constantly talking to your brain, and this happens through millions of neuronal connections from a big nerve called the vagus nerve. We call this general interaction the gut-brain pathway or the gut-brain axis. The bacteria that are part of this system are constantly making chemical signals, including serotonin, that trigger different responses in your body that contribute to stress and mood and help you modulate your body's inflammation and overall contributes to your general well-being.
Okay. That's something I never really knew, and I'm glad to hear that it's something that we can maybe help contribute to better gut health with nutrition, right? So there might be some control I have over helping my overall gut health with the food that I eat. So the common phrase is, you are what you eat, right? So how does that, it kind of sounds like whatever it is that I'm eating can and does contribute to this important gut biome. What are the foods that I should be focusing on in order to help have a healthy gut?
So the bacteria that live in your gut, they thrive based on what you give it to eat. So generally, friendly bacteria thrive on a high fiber, whole foods based diet. So you want to take in plenty of fruits and vegetables. You want to improve that environment through taking in fermented foods. And what you want to do is avoid the highly processed foods that you find that are shelf stable, that contain unhealthy fats, a lot of sugar. These processed foods also frequently contain other things such as emulsifying agents, preservatives, or artificial sweeteners. And these can contribute to inflammation within the gut and the degradation of the gut lining, and also favor unhealthy bacteria.
Okay, so give me some ideas of fermented food if I've never eaten them before. What are some examples?
So, in today's society, we tend to overlook fermented foods. They're more of a feature of traditional diets. But in general, fermented dairy products, kefir, yogurt, those are always good. Fermented vegetables might include kimchi or sauerkraut. You can also drink fermented.
Sauerkraut.
It's great. And you can make it yourself at home as well.
Okay, so 1 to 2 servings of that per day?
Yeah, I would just try to take in a regular amount. You might need to start a little bit lower and then kind of gradually work your way up depending on how your body tolerates it. You can also have fermented drinks like kombucha.
Oh, I love kombucha. Supposedly it has a lot of probiotic. It has some type of probiotic in there, from what I know. Leading to my next question, which are what is a prebiotic and what is a probiotic, and how does that affect the gut biome?
Got it. So these terms frequently get mixed up. Probiotics tend to refer to the bacteria. Prebiotics are the fuel that help these bacteria thrive. So when we say prebiotics, we tend to think fiber. For example, there's different types of fiber that these bacteria can digest. So like commonly supplements might include like inulin or fructooligosaccharides. But in general, you can get these from a wide variety of plant fibers.
Okay, so if I just have a healthy amount of vegetables and fibers, I don't necessarily need to supplement with a prebiotic because I'm getting that in my food.
Exactly. If you decide to supplement, you might have some benefit, but it should be used as a supplement and not a replacement. Okay. So maybe on days where you're not able to eat an adequate diet, that might be beneficial.
Okay, but probiotics, that's something I should be taking every day.
Yeah, so you have to be a little bit cautious on probiotics. Okay. I do think I've seen a lot of patients with tremendous benefit from taking them. I'm not going to recommend a specific probiotic supplement because I think that this is highly individualized based on what your needs are. When you take a probiotic, you're essentially introducing an artificial amount of specific strains that doesn't necessarily adequately reflect the biodiversity that you want to achieve in your gut, but it can be beneficial. So there might be a little bit of personal trial and error involved in that as well.
Okay, understand. I take a probiotic every day, so I'm going to have to maybe look to see if I need all of that. In terms of everyday life, I know a lot of us are stressed. We're doing too much and we're working, we're with our kids and our families. How does stress, high stress, affect our gut biome? Does it affect our gut biome?
It definitely affects your gut biome. So when you're stressed, your body makes chemical signals, stress hormones like cortisol, catecholamines like adrenaline or norepinephrine. And these trigger changes in your body. It might slow down digestion. It might reduce the amount of blood flow to your intestines. And among other things, it changes your immune system. So over time, this can contribute to the breakdown of the lining of your gut, leading to the so-called leaky gut syndrome. It can also cause you to have a shift in the types of bacteria that are living inside of your gut. So frequently, if you're living with a lot of stress, you might also experience digestive issues as well.
Which I'm kind of thinking of my own personal gut biome and what I've been experiencing now that I'm older and I never had, which is acid reflux. So I know so many people that have acid reflux. And is that because of the foods that I'm eating? Is that a result of the gut biome I have, stress? What are those factors that are contributing to maybe like an acid reflux, which I know so many of us have?
So as you age, your body starts to naturally produce less acid. But it also means that the sphincter, which goes from your esophagus down to your stomach, might also loosen up, and you might start to experience some reflux of that acid coming up as well. It's a lot of different causes that can come of that. Certainly, certain foods that might slow your digestion or cause bloating can contribute to that sensation. Stress can contribute to that sensation as well. Other lifestyle factors like obesity as well. So it is kind of a multifactorial thing.
I see. Now, another symptom that I typically hear people are experiencing within their gut is bloating. So if I'm experiencing bloating, does that necessarily mean that I don't have a healthy gut biome? Or would that maybe be a symptom of food that I ate?
Right. So when you think about bloating, that generally comes from an excess of gas, and it might be accompanied by belching or flatulence. These are not
Farting.
farting. These are not generally normal symptoms, so there is some optimization that can happen. It could be due to diet-related things, especially if you have an intolerance to certain things in your diet, like lactose or gluten.
So sensitivities, food
Yes,
sensitivities.
food sensitivities can be a component of that as well. Also, that it might indicate that you have more of certain types of bacteria in your gut. So there is definitely some work that can be done.
Would you recommend somebody do a food sensitivity test? And if, let's say I'm more sensitive, let's say I'm gluten-free because I have a gluten intolerance. How does my particular gut respond to that if I'm gluten intolerant, but I'm giving myself gluten?
So there are food allergies and then there's food sensitivities. Food sensitivities are kind of more of a delayed reaction, which can be tested for as well. You can get, those are commercially available now, so you can get a food sensitivity test to see what might be triggering your diet. They tend to be a little bit on the expensive side, but so you can benefit from just a plain elimination diet where you're cutting out common allergens and see if that helps you first. And if that doesn't, you can try a food sensitivity test.
Okay. And one other important question I have, because I know so many of us are on medication, prescription medication. How does prescription medication affect our gut microbiome?
There are so many prescription medications that have GI side effects. I'll touch on the few big ones, the first one being antibiotics. So antibiotics are not just harmful to bad bacteria, they can be harmful to good bacteria as well. And you can wipe out the good bacteria with the bad. When that happens, they've done studies that shows even after months, the microbiome is still not back to the way that it used to be. Not to say that you shouldn't take antibiotics if you really need them. The main take-home point from this would be to avoid unnecessary antibiotic use and to just try to foster a good lifestyle so that you can recover from that as fast as you can. There are other common ones like antacids, which affect the pH balance of your digestive tract. We talked about that a little bit already, and also non-steroidal anti-inflammatories such as Motrin. These have also been shown to shift the diversity of your microbiome.
How long does it take? Because I know that I'm a little bit resistant to giving my kids antibiotics because they're so young. How long, are there studies that show how long it takes for the gut microbiome to repopulate with that good bacteria? Because you mentioned a few months. Maybe that's not enough time. Does it take years? Possibly?
I think possibly even that. I'm not familiar with the exact amount of time, but I know that's actively being researched right now.
I remember when I first started dating my husband, he would take a Z-Pack every time he was sick. And the biggest concern I had was him wiping out his microgut biome. And he had no understanding of what that meant. And I noticed he would get sick almost every few months. And it was a cycle until he actually stopped taking the antibiotics every time he was sick and did not need it because it was viral, which we touched upon in one of the earlier episodes. So I'm definitely in line with that. Are there tests? So for somebody who wants to know if they have a healthy gut, are there tests that they can purchase online or from their doctor's office to see what their overall gut health looks like?
There are, and so there's a variety of tests to look at the gut. We talked about food sensitivity testing, and they have tests to look for leaky gut and other health conditions like that. On the lower digestive tract, they can do stool analyses. So from that, they can look at specific populations of bacteria in your gut, and you can track that over time as well. You can also look for parasites or any signs of bleeding. On the upper GI tract, they can look at they can look for small intestinal bacterial overgrowth. or they can look for the presence of yeast. There's a lot of different tests you can order. They might, again, not be necessary if you are working on specific goals like the reduction of indigestion and flatulence, improvement in the quality of your improvement in the quality of your bowel movements, and you're making lifestyle changes that show benefit, then you might not need some of these tests.
Okay, that's good to know. You touched upon yeast, which I know so many women, commonly known as candida, right, are dealing with. And what types of foods should women that are dealing with an overgrowth of yeast or candida, should they be eating the same types of things like the fermented foods and the higher fiber?
So generally, candida, it can show up in a number of places. It can show up in your mouth, in your stomach, or even in your vaginal area.
Vagina.
So these
You're so formal to make.
The presence of yeast may or may not indicate an immune system problem. For example, in the mouth or in the throat, if there's yeast, that could be a sign of immunodeficiency.
I see.
So it should always be checked on by a physician. But in terms of overgrowth, you generally want to avoid sugar. Keeping the simple sugars down in your diet and making sure your stomach acid is appropriate is important for that as well. They have testing that you can do for that, and they have treatment as well. For vaginal candidiasis, they've shown that lactobacillus and probiotics actually make a difference for that. So there could be a benefit with probiotics as well. But in general, yes, a healthy diet that is low in processed carbs
and sugars. So I guess what I'm gathering from all of my questions and the answers that you've given is it's really diet. Having a diet high in fiber, vegetables and fruits, low in processed foods, pretty much anything that's on the shelf that stays there for a while. Try to minimize that. And that can give us an overall healthy gut biome.
Yes,
if we
definitely
just follow that one rule.
Yeah, I mean, I would say that is definitely one of the cornerstones of gut health is taking in the right foods, the high fiber fruits and vegetables, the fermented foods, and staying away from the unhealthy processed foods.
Okay, amazing. So that's my one takeaway, if that's all that I remember from this. But is there anything else that you want to add?
Yeah, so with regards to lifestyle and the gut-brain axis, it does go both ways. So when your gut is healthy and it's making the right signals for your brain, it improves mental wellness. And when your brain is healthy and you're managing stress appropriately through lifestyle and through
exercise, maybe.
Exercise, mindfulness. It also talks to your gut. And it's a very amazing interplay. They've actually shown that in situations where you have trauma or even traumatic brain injury, if they biopsy the gut, you can see almost an immediate start to the breakdown of the gut lining and changes like that. So the brain and the gut, they talk to each other, and it's bidirectional. So while improving gut health improves all aspects of your life, improving your overall well-being also improves your gut health.
That's amazing. Okay, well, thank you, Dr. Allen, for being here with me. And thank you guys for listening. We'll see you on the next podcast. This podcast is sponsored and brought to you by One Body Medicine. You can learn more by visiting onebodymedicine.com. That's the number 1, bodymedicine.com. You can also follow the show on social media under the handle Pure Wellness Pod. Thank you for listening, and we'll see you next time.